worker and psychotherapist here at My Therapy NYC. And I'm here to present a webinar tonight on PrEP. The title of the webinar is PrEP for Me? Understanding the Pill, Its Effectiveness, and HIV Prevention. And just a couple of housekeeping things before I get started. If you're with us live, if you notice to the right of your screen, there is a text box where you can write questions throughout the webinar, and at the end we'll have a few minutes to respond to them. Just to know that all questions are anonymous, only I see them, and also there's a 30-second delay before I get them. So if you write a question, just know that it'll be a few moments before we get started. Just a little bit about My Therapy NYC. We're a group psychotherapy practice. We provide individual, couples, and group therapy. We also present webinars throughout the year and publish blogs as well. So you can get more information about us on our website, which is listed on the screen here, and then we'll post again at the end of the webinar. So let's get started. So, is PrEP for me? Understanding the pill, its effectiveness, and HIV prevention. And so in the webinar, we'll be answering the questions: what is PrEP, how PrEP works, whether or not it's right for you, and how to use PrEP effectively to reduce HIV transmission. So what is PrEP? PrEP stands for pre-exposure prophylaxis. The word prophylaxis means to prevent or control the spread of an infection or a disease. The goal of PrEP is to prevent HIV infection from taking hold if you're exposed to the virus. So how does PrEP work? PrEP works by taking one pill every day by mouth. Truvada is the name of the pill that was approved by the U.S. Food and Drug Administration, or the FDA, in 2012 and is the medication known as PrEP. Truvada is a combination of two medications currently used to treat those who are living with HIV. Truvada has been shown to be safe and to help block HIV infection 92 to 99% of the time when used correctly and consistently. In order for Truvada to be effective, you must take it daily. The presence of the medicine in your bloodstream can often stop HIV from taking hold and spreading in your body. So if you don't take PrEP every day, there may not be enough medicine in your bloodstream to block the virus. So how to determine if PrEP is the best option for you? PrEP is not the right fit for everyone, but may be useful for individuals who are at risk for HIV infection through sex and injecting drug use, and okay with the idea of taking a daily pill to prevent HIV. So the CDC website offers a number of questions that you can ask yourself, and if you answer yes to any of them, you may be a candidate for PrEP. And of course, you want to speak with your doctor first, and they will likely ask you these questions. The first is, do you use condoms sometimes or not at all? Do you often get STIs or sexually transmitted infections? Have you taken post-exposure prophylaxis or PEP more than once in the past year? And if you're not familiar with PEP, PEP is a treatment that if you would take if you engage in any high-risk sexual activity or injecting drug use and believe that you have a high risk of exposure to HIV. So you would go to either an emergency room or a local clinic, and it's a 28-day treatment that is effective, most effective as the sooner that you get to the ER or to the clinic. It loses its effectiveness after, I believe, 72 hours. And again, a good question for your provider. The next question, are you in a serodiscordant relationship where your sexual partner is HIV positive and you are negative? Are you in an open relationship or having anal and or vaginal sex with multiple partners? Again, these are high-risk sexual behaviors, so just knowing if this is something you engage in, you may consider asking your doctor about PrEP. Also, are you having sex with someone whose HIV status you don't know? And then finally, are you having sex with someone in a city or region where the HIV prevalence is high, that is, where there are large numbers of people living with HIV? So how to use PrEP to reduce HIV transmission. And if you think you may be at substantial risk for HIV, first thing you'll want to do is talk to your healthcare provider to learn if PrEP is the best option for you. If you and your provider agree that PrEP might reduce your risk of getting HIV, they will conduct a general physical and test you for HIV and other sexually transmitted diseases. Your blood will also be tested to see if your kidneys and liver are working well. If you have any pre-existing health conditions related to your kidneys or liver, you may not be a candidate for PrEP. If these tests show that PrEP medicines are likely to be safe for you to take, your provider may give you a prescription. And then if you don't have, or if you do have health insurance, your provider can talk to you about if you do not have health insurance, your provider can talk to you about medical assistance programs that help pay for PrEP for some patients. So if you do take PrEP, you'll need to follow up regularly with your healthcare provider, usually 4 times a year or every 3 months. You would have blood tests for HIV infection and see if your body is reacting well to Truvada. You'll also receive counseling on sexual and injection drug use behaviors. And so the next slide, how PrEP supports health and well-being. So as group psychotherapy practice, we are also concerned about the mental health and the impact of stigma and shame related to HIV transmission. And PrEP is an effective intervention around shifting that. Since the AIDS crisis, sexual orientation and sexual behavior have become increasingly conflated. PrEP has shifted how we think about HIV and its impact not only on physical health, but also on mental health. The advent of PrEP has begun to alleviate fear and anxiety many people living with HIV have experienced because of the possibility of transmission to a negative partner. Similarly, taking control of your sexual health with increased knowledge of your risk level and preventive steps like PrEP allow us to feel more empowered and have more control of our sexual encounters. And remember that communication in your relationships and with sexual partners is key to your health and wellness. So PrEP and mental health. Since the AIDS crisis, sexual orientation and sexual behavior have become increasingly conflated. And this suggests that those of certain sexual orientations are at higher risk for exposure and transmission of HIV. And the fact is, it's actually about the sexual behaviors you engage in that are not unique to certain sexual orientations, but rather there are particular sexual behaviors that are higher risk. Concern about HIV transmission has brought about both awareness and education, and also fear. When fear enters in our lives, we're faced with several options. It can affect how we communicate, whether or not we feel empowered to ask for support and get help or get more information, or we might ignore this. And so that brings into the idea of stigma and how stigma has had an impact and has been shifted and begun to shift with the advent of PrEP. So HIV, PrEP, and stigma. Some examples of everyday stigma that you may have encountered or heard is people referring to HIV as AIDS. So HIV is a chronic health issue and less of a terminal illness. AIDS is a syndrome that occurs when there's a certain level of the HIV virus in your blood. Also, presuming because someone is HIV positive, they're sick, contagious, or dying. That's not necessarily true. People can be HIV positive, be very healthy, be receiving treatment, living a healthy lifestyle, and not transmitting the virus. Using the word clean when referring to a negative HIV status or combining drug use with HIV status, often referred to in online personal ads as the acronym DDF or drug and disease free. So this is just the idea that someone is clean implies that someone who's HIV positive is dirty. And the fact is that HIV is a virus that anyone is susceptible to if they were to engage in any risky behaviors. Dismissing, judging, or rejecting someone who is HIV positive when they disclose their status. trusting that every sexual partner will be honest in disclosing their status. Because of stigma, people may not be willing to disclose their status, so that may be a way in which stigma has had an impact on people sharing their status. Perceiving HIV-positive people as failures, promiscuous, or that they deserve to become infected with HIV. No one deserves to become ill. It's a fact of life. It happens as a result of a number of factors. The word promiscuous implies that people who have sex, there's something negative about that. The fact is that sexuality is a healthy part of everyone's life. Everyone is a sexual being. Discussing someone's HIV status, whether it's rumor or factual, without their consent or knowledge. Ways in which HIV status becomes gossip or sharing without someone's permission is a violation of someone's privacy. Providers are held to laws that actually protect people's privacy around these issues because it's important, it's significant, and shouldn't occur without someone's permission. Refusing or withholding from getting tested for HIV for fear of a positive result. So the impact of stigma and fear and shame can prevent someone from going to get tested and to find out and to get the treatment and support that they need. And then finally, specifically related to Truvada, is referring to someone who is taking Truvada or PrEP as a Truvada whore, or believing that taking Truvada or PrEP promotes promiscuity or sexually irresponsible behavior. The fact is, taking Truvada is a responsible behavior that someone is taking to be more responsible for with their sexual partners, for their health and the health of their partners. So PrEP and decision making. So PrEP, like condoms and other safe sex materials, offers an opportunity to communicate, to get more information, and make proactive choices about how to approach sexual situations. When we're able to make informed decisions in our lives about health and well-being, we can feel more empowered and have a greater sense of control. And then PrEP and communication. Taking PrEP creates opportunities to communicate with a partner about health status. You can ask a partner if they are on PrEP or not. You can make informed decisions about what you will or won't do sexually. And you can take control of your level of risk and thereby your health and your partner's health. So that brings us to the end of the PowerPoint. I hope you found that helpful. We're going to shift to the discussion portion of the webinar, and we'll begin to answer questions that you may have. So let's see, the first question we have, will PrEP still work if I miss a dose? That's a good question. I've been reading and researching a lot, and obviously this is a question to talk with your provider and your doctor about. Information that I got is that PrEP is most effective when you take it daily, and if you skip a day, over time, if you stop taking PrEP, it can reduce its effectiveness. So if it's 92 to 99% effective if you're taking it daily, if you skip a day or a few days or a week, that number goes down. Let's see, next question from Connor. If you're on Truvada, do you still have to use condoms? Because Truvada is 92 to 99% effective, there is still a risk of transmission. So it's a choice that you would make with your partner that you would communicate around. You're increasing your safety, the more resources, the more tools that you use. So I think it's a personal choice. It's a choice to talk with your partner with your provider. And I think that would be my response. And then we have a question from Jason. Is it still effective if I stop while I'm not sexually active and then restart when I am? I think the answer is similar to the previous, is that if you stop, it's going to reduce the effectiveness over time. You definitely want to talk to your doctor. If you know that you're going to take a break from from being sexually active. And what I did actually read is if it's going to be a month or a couple of months that you probably don't want to stop taking it, you want to have the levels of the medication high enough in your blood system so that you're not starting over to rebuild your resistance to the virus. And let's see, other questions. Ryan has a question: why is it called PrEP if the drug is Truvada? PrEP is the treatment, and Truvada is the drug that is used. Is the treatment, is the drug for the treatment. Here's another question from Eric. He asks, how many people are currently taking PrEP in the US? I'm not sure, I don't know, but I think that the numbers are increasing, and with the numbers increasing, people are becoming more aware, increasing their safety and reducing their risk, becoming more informed. So, I think what's valuable about presenting a webinar like this is that we are able to disseminate information about PrEP, discuss the health and mental health impact that has on us, and talk a little bit about stigma and how PrEP can undo that, and begin to talk more openly about a topic and an issue that still does linger, or have some lingering effects from stigma associated with HIV transmission. So it looks like the end of our questions. We are at the end of our webinar. So I hope this is helpful. I hope you found this informative. If you'd like more information about PrEP, about our services at MyTherapy NYC, you can go to our website at mytherapynyc.com. We're also posting a resource guide with some links to more information and resources about PrEP. Again, you definitely want to talk to your healthcare provider if you're considering PrEP. You can reach out also to us if you're looking for support around that decision making and around any coping related to that. So thank you for attending, and have a good evening. Thank you.